Welcome to Fear Factor. We are going to be talking about everybody's favorite topic today, which is Medicaid and Medicaid buy-in and workability and all the things, and trying to make sure that the idea of losing Medicaid does not prohibit us from getting gainful employment and making money, because we all need money and we all need Medicaid. So, anyhow, if at all possible. All right. So, on that note, I'm going to turn it over to Ann Tapia from the Department of DD, and she's going to kick us off on our training.
Great. Thank you all for being here today. My name is Ann Tapia. I'm with the Department of Developmental Disabilities, and I have the privilege of getting us started today. You can go to the next slide. The idea of fear factor started because we often hear that there are concerns about working and maintaining benefits. We do just want to mention that the information that's provided here is related to today, June 24th, 2026. Things definitely change on a regular basis. And this is not intended to be an individual consultation. We highly encourage that you take what you can out of this information and then schedule a meeting with a benefits coordinator and do a benefits analysis so that you can understand the specific needs of each person who has Medicaid that wants to work and what the implications are of that. So you'll notice we do have a disclaimer basically telling you that this is important information, learn what you can, and keep learning to get the specifics of what's important for each person. Today's session, we're starting off with our introduction and just laying out the context of what fear factor is. Most of our time will be spent talking about Medicaid for people who are working, and then we'll wrap up with a Q&A. We will end the recording at that Q&A time. We find that that helps people to ask questions, and we can answer the best of our ability as it is today, June 24th. So we're going to kick off with a poll. Lisa's going to launch that. We want to get a sense of who's here today. Many of you have dropped in the chat, but we also recognize that that is not all inclusive of who you are as a person. So the options for your role today are service and support administrator, a county board staff that is not an SSA, a family member, a person with a disability, a provider, opportunities for Ohioans with disabilities, somebody from the Department of Developmental Disabilities, or something else. If it's not listed, we'd love to know in the chat. This does help us to make sure that we're talking to the right audience and providing the right information to you. And we do take a look at that after the fact to get a sense of who's showing up to these. I'll give you a few minutes to get your answers in.
I was going to
Few
say, get a
seconds.
couple more answers. We're at 80%. Getting a couple more stragglers. I always love to see who's coming in. I'm excited. There's some people with disability in the call today, some providers. I'm always excited. I love my SSAs, don't get me wrong. I'm a county board staff, but I always love it when people are going out of their way to come to these. So, all right, I'm going to go ahead and I'm going to end the poll, and I will share the results with all of you so you all know who's in the room today. So we have about 75% of the participants are service and support administrators, with 18% from other county boards. But yay, glad we have a family member. And I know a lot of you have dual roles, but person with a disability, we have providers. And OOD and DODD must only be on the panel at this point today. So anyways, and I think there's somebody else, but I will stop sharing. We'll check and see who else is in the room today. All right, I'm going to go ahead.
So our purpose behind all of our episodes of Fear Factor are to be able to provide enough information to those professionals who are out in the field, whether you're an SSA and or another professional, another role. And we want to make sure that job seekers, employees with developmental disabilities, the family members, and really anybody else who has questions and wants to know about benefits has enough information to be able to move forward in figuring out what that pathway to employment might look like, whether that's exploring, pursuing, or maintaining employment. We recognize that we have to face some of the fears about work and maintaining benefits in order for us to move forward. So this session is intended to give you enough information, the facts, and then lead to some confidence in that forward momentum. We have had a wide range of other topics that we have pursued. We encourage you to binge watch those episodes on your own time. The other episodes have included things like benefits analysis, stable accounts, SSI or supplemental security income, the Social Security Disability Income or SSDI, general information about Medicaid, ticket to work, and then like today's session, Medicaid buy-in for workers with disability. We've also done sessions about reporting requirements and so many more. We have an information sheet that has all kinds of resources in a couple page document that helps you navigate some of this complicated information and point you to those trusted sources to make sure you have what you need to pursue employment and maintain benefits. So we have the link I'll drop in the chat in just a moment to access all of that great information, including the recordings and that resource document.
Awesome. And I just put the F.E.A.R, this particular PowerPoint is in the chat box right now too, for anybody asking.
Perfect.
All right, so we're going to go on to poll number 2, which is what is your current level of understanding about maintaining Medicaid benefits for people working? So, and this is not a place to be proud, although if you are good at it and you're an expert, we're always looking for that. So let me go back and open up that poll and see where everybody is feeling today. All right, so what is your current level of understanding about maintaining Medicaid benefits? None, limited, enough to be dangerous, which I'm afraid might be where I'm at right now. But if you're an expert, we want to know.
I don't know, Lisa. How do the attendees consider the folks with lived experience that have to go through it and learning along the way?
Oh yeah. I have no I mean I'm going right now I'm on officially on my second appeal with Social Security for my son who receives Medicaid services. So I'm like and I pulled in lawyers. I can't do it. I'm done. It's just done. So it is a lot. All right, we have 82%. I'm going to go ahead and end the poll. We got one expert in the room, you guys. That we always like to know that. So we do have some folks that are feeling like they're right at the beginning of this process, 8%. And limited is definitely the winner for today, with 60% of the people on the call having limited knowledge. And then the enough to be dangerous is in that 30%. And one soul was proud enough to say that they might be an expert. So thanks for sharing that. And if you want to private message the hosts and panelists who you're feeling, we might recruit you in the future, depending on what your specialty is. So, all right. Well, I think we're going to go ahead. I'm not sure. I changed my angle, and so I can't necessarily see you.
You're good. I'll keep us moving. So, in just a moment, we're going to pass it over, but we wanted to do a quick introduction of who our guest speakers are today for this session. Kim Bernardi is with the Medina County Board of Developmental Disabilities. Christine Brown is with Ohio State Nysonger Center. And Darenda Geer is a certified work incentive transitioning youth practitioner with DBS Consulting. We have a whole group of people who, some of which you see on the screen, others may not have their cameras on or be here today, but you'll see a lot of other people who help support either other sessions or are providing the resources and ensuring that the information that we share is up to date and relevant for today. So these next two slides, those two slides are showing you all of the other folks who are part of our production team, as we lovingly call ourselves.
Yep, and we love all the representation we have from, both other statewide agencies as well as the private sector, as well as county boards and COGS. So thank you to all of those folks. And if you ever want to join us, let us know. Ann and I are happy to put you through our very thorough interview process.
And with that, we will pass it over to our presenters. Thank you all for being here today.
Thank you. Hi, my name's Kim Bernardi, and I will be going first. So, Medicaid, complicated, confusing, changing. Well, we got this. So, on our agenda,
Sorry.
that's okay. Okay. On our agenda, we're going to discuss what is Medicaid, disability benefits, healthcare eligibility, different types of Medicaid, Medicaid waivers, and next generation MyCare general overview. Okay, so Medicaid is a healthcare assistance program. Individuals, different ages, there is a income limit, and there's also an asset limit to get Medicaid. People usually pay some of the costs and maybe just a small copay or no cost at all. It just all depends. Sometimes Medicaid may cover a certain amount and the doctor charges a little higher, so you might have a little copay, or the doctor's office may accept that payment from Medicaid. It's a federal state program. It varies from state by state. Every state has their own Medicaid rules. Next page.
I'm trying, Kim. I
Okay.
lost my little cursor.
You're fine.
And you know that button I pushed earlier? Oh, there we go. Okay. Messed up again and changed my screens. There you go.
Okay. There's different ways to become eligible for Medicaid. So if an individual applies for Social Security supplemental income and is approved by Social Security, then they will automatically become eligible for Medicaid. Individuals who are age 65 and above, blind or disabled, have the financial need, they can also be qualified for Medicaid. Beneficiaries newly eligible for Social Security disability insurance, which is SSDI, that means they have worked and they paid into Social Security work and had work credits, they would get SSDI benefits. They could get Medicaid. And again, if somebody is working and deemed disabled, they can get Medicaid buy-in for workers with disabilities. And we'll go over more of that. Okay, Medicaid offers many, many different programs to adults, children, people with disabilities. These programs provide healthcare coverage consisting of primary and acute care package along with long-term care. Medicaid, if somebody has Medicare, Medicaid can also pay their Social Security or Medicare premium if they meet certain income requirements. All right, and there's different types of Medicaid. We're going to go over these in a little bit more detail, but there's regular Medicaid, or it's called ABD. There's Medicaid 1619B. We have modified adjusted gross income, or MAGI adult and MAGI child. We have Medicaid for buyers, buy-in for workers with disabilities, Next Gen MyCare. Right now, that's only in so many counties. It's going to transition to all the counties. There's Ribicoff Kids. This is for kids in foster care, parents, caretaker relatives. Healthy Start. This is for children age 19 or under, and the family meets the income limits. And the parent can also get on Medicaid if they have children. Medicaid home and community-based waiver services. There's different waiver services. There's individual option waiver, the level 1 waiver, self waiver, passport waivers for the elderly, choices, home care, assisted living, that's also for the elderly. Special recovery services waiver, that's for individuals with mental health. And then you have the Ohio Rise waiver. That's for children more with behavioral needs. Okay. So ABD, or Age Blind Disabled Medicaid, So again, you have to be 65 years or older, considered legally blind. There's a definition that they have that considers you legally blind, or a person with a disability. And you meet specific income requirements. And also you can only have $2,000 in assets if you're single, 3,000 if you are married. And SSI, the federal benefit rate right now is $9.94 a month. So that's kind of also the income limit that they go for this ABD Medicaid is $9.94 a month and $14.90 for a couple. Okay, and state Medicaid covers a plethora of things: inpatient, outpatient care, x-rays, laboratory tests, transportation to medical care. If an individual doesn't have transportation, they have a doctor's appointment, Medicaid can pay for their transportation to their doctor's appointments. States often cover many benefits: physical therapy, occupational therapy, speech, eyeglasses, chiropractor. Not all states cover anything in dental. I believe Ohio does cover for cleanings, dental cleanings, but it does not cover cosmetic for dental. Okay, Medicaid 1619B. This is somebody who was eligible for SSI benefits, so Social Security supplemental income, which that income fluctuates based on your earned income. Some individuals who are working more and they have more of earned income may not see an SSI check for certain months because their income's too high, but they're technically still eligible for SSI. So if another month your income goes below the $9.94 a month after all the calculations, then they'll get some SSI. But if your income's higher, as far as the threshold's concerned, they will still get their Medicaid because they're technically still eligible for SSI benefits. Okay. Medicaid 1690B allows individuals to work and earn extra money and still, when they're not getting their cash payments, and still have their Medicaid. So somebody can work and still have their Medicaid while they're still eligible for SSI benefits. They can also get their SSI check. So like I said, if your income is at a certain point, and you're not getting an SSI check because of all the calculations and they count your income, your earned income, and then your payments go lower, you're going to get an SSI check and you're still going to get your Medicaid. And you don't have to fill out a new application. MAGI Medicaid. MAGI Medicaid is for children, childless adults, married couples with children, families with children under 19, children up to age 19. This is also an income limit and asset limit for MAGI Medicaid. It's also, they go with your gross earned income before taxes. And on the next page, it'll show you like the different income levels and family household size. So on this one, it shows you like the household size, one individual. If you're looking at children without insurance, it's 2,740 month gross earned income for that household for the child to and under to be eligible for MAGI Medicaid. Family of 3 for a child without insurance is 4,690 a month gross earned income. So if you just, in adults, if there's a family of 3, a MAGI adult would have to, there can't be more than $3,028 a month of earned income in the household. So those are just the different household sizes with the different income limits. Healthy Start. This is also a children's Healthy Start program. It's called CHIP. And it provides, again, free and low-cost health insurance for families and children. It's designed to increase our health care coverage for family and children with too high income too high to qualify for Medicaid, but it's also too low to afford private health insurance. So you have to have children 18 years or under, and the primary caregiver with a child 18 years and under. Have to be a U.S. citizen, national or non-citizen legally admitted into the USA, uninsured and eligible for other Medicaid. Okay, this is just all about the CHIP program again. So if we go to the next slide, it'll show you also the different household sizes and the gross income limits per month that a family can have to be able to qualify for this program. Also, their resources have to be under $2,000 in assets. However, you are able to own a home and a car, so those aren't really considered assets, because some people do ask that question. Okay, now we're gonna take it off to Christine.
Thank you, Kim. So my name is Christine Brown, Clinical Research Assistant, Self-Advocate Faculty. And what is Medicaid Buy-In for Workers with Disabilities? It was founded in 2007 in Ohio, and it's a category that enables employed individuals, people to increase their income and resources without the risk of losing Medicaid coverage. This group is 16 through 64. You must be a U.S. citizen or qualified non-citizen, be a Ohio resident, have a disability as defined by the Social Security Administration, working full-time, part-time, or self-employed, from which state or federal income and payroll taxes are paid or withheld, and a person can meet the eligibility criteria for Medicaid buy-in for workers with disabilities or another category of Medicaid. Next. So, Ohio Workability, this was the one I worked hard on creating. This is the category that's newly done for people 65 and older with having the same qualifications except for the age limit. But they only need to work 1 hour a month to qualify for this, compared to the others. One is averagely like you're not required to have to do 20 hours, but some people ask that. And you like having the definition defined disability by Social Security, and working with no specific employment requirement mostly. Sometimes caseworkers ask, well, don't you need to be at 20 hours to do this? No, you don't. And it does not meet the eligibility criteria for any other category of Medicaid. So for long-term care service such as home and community-based services will be companion coverage with the workability. So it's very similar and provides the same coverage. Next. So here's the difference of the Medicaid buy-in for workers with disabilities and the workability. They look at the individual's net income compared to up to the 250% family federal poverty level for the family size, and effective January 1st, the 250% federal poverty level was $3,325. and Ohio applies several disregards up to $20,000 of earned income disregard. Then in the workability, it's similar, doing the net income and individuals' net unearned income after the disregard is less than or equal to the SSI or residential state supplement income standard. And Ohio is applying a less restrictive income methodology. There has been a talk of this change of the $20,000 earned income exclusion to also let unearned income be up to the combo, so no more than $20,000 between earned or unearned. So somebody might say to do $10,000 disregarded of earned and $10,000 disregarded of unearned. That total is $20,000. In the current law, it's still not allowed. We've been fighting for that. It didn't get done in the big Medicaid committee. So hopefully that will be in the next 2-year budget. So like the resource limit is $15,668, and they only count the person's resources as being considered. So not like the whole family. And the working people may incur a patient liability regarding their bill for waivers. Enrolling in MBIWD alleviates patient liability, and currently they are not collecting any premiums for Medicaid buy-in or workability.
Hello.
Darenda?
Thanks, Christine. Good job. I did want to point out on most of those slides at the bottom, you'll see a resource. Medicaid is a federal program. Yeah, at the bottom. Thanks, It's a federal program that allows states to manipulate, change criteria according to what fits them. Anyway, everything's based on law, and those are Ohio administrative codes. So if you ever have questions or you need to know specifics about different things, always go back to the OAC, the Ohio Administrative Code. Thank you. Okay, many years ago, working with the group, we were trying to figure out ways to help communicate and make things easier to understand, if you will, because nothing in disability benefits is easy. It's all complicated. So we came up with this Medicaid Buy-In for Workers with Disability Decision Game Board. In this presentation, it's slides, but we can provide that handout to you if you're interested in having it. But anyway, it's pretty easy to use. It just kind of explains how to determine whether someone is eligible for Medicaid buy-in or not. I won't go through the criteria that Christine already did. But you just follow it just like a regular kind of, is it not Monopoly? I can't think, Chutes and Ladders. It's kind of like a Chutes and Ladders type game board. You can go to the next slide, please. You start at age 1. I mean, it's fairly easy to get through, answer the questions, and then you can go all through the different game boards to determine whether or not you're eligible and even come up with what a potential premium might be. And the next page is ongoing. We also give you in here, the numbers again for the poverty level. MBIWD basically is 150% of the poverty level, depending on the number of people in the home. But then, as Christine said, there's different or a higher percentage too that can also keep you eligible. A person can actually make significant income and be eligible for MBIWD if also disabled. And the next one, also how to apply for MBIWD. through your local job and family services. You can do it online as well through benefits.gov, which I think they changed the name of that website. And I don't know it off the top of my head, to be honest with you. And then there are certain forms that are required also. If a person is already deemed disabled by Social Security, meaning they're receiving Social Security disability insurance, SSDI, or supplemental security income, and they apply for MBIWD, they don't have to go through another disability determination. But if not, then Job and Family Services Medicaid will send their application to the Division of Disability Determination to gain a disability determination. I feel like I'm repeating myself. Before they will make them fully eligible for the MBIWD as well. There are different places or agencies that can help you with this type of stuff. Disability Rights, Ohio, Southeastern Ohio Legal Services, they have different locations. Legal Aid Society of Greater Cincinnati, Center of Vocational Alternatives, and then there are people like me that worked for a DD or some other agency and then opened their own private business, and then we can provide that support as well. Next slide. Disability Benefits 101. This was another venue, if you will, that we came up with to help people to try to understand benefits. As we said from the very beginning, all this information that we give you is not to make you the expert. It takes a lot of education and years of experience to do that, and then it's still questionable at times. So we try to give you some tools. And this DB 101 is another tool that you can find online. It gives you general information. It does not take the place of having a full benefits analysis, but it is a good tool to use. Next slide. And I believe I'm back to Kim, right?
Yes, you are.
Right.
I just want to make a quick correction. Medicaid, you do not have an asset limit for that, but the other Medicaids you do. But anyways, let me go to what I'm doing now. What is the difference between a Medicaid and Medicaid waivers? Well, Medicaid waivers is a health insurance program, which we all know. Medicaid waiver is part of that health insurance program, which allows individuals to stay in their homes and avoid moving to a facility. Medicaid waivers allow states to waive certain eligibility requirements. And one of the requirements is their income. You can have a higher income and get a Medicaid waiver compared to just the ABD Medicaid. The state allows to provide home and community-based services instead of institutional care. So that way, if somebody has a waiver, whether it's elderly on the passport waiver, assisted living waiver, or individuals with disabilities on the IO waiver or level 1 waiver, self waiver, it helps allow individuals to be able to live in the community or at home and have provider services come in to assist them with living and having their independence. The goal is to improve care, expand coverage, and reduce the cost, because it's costs more to have somebody in a facility than it is to provide care at their house. And it's also, everybody wants to stay at home as long as they can, so we do have these waivers. Like I said, the income is higher, so we're going to show you on the next page a calculation, because there can be what's called a patient liability if your income is too high. Okay, so what we have is when you're enrolled in a waiver, your countable income can be over what basic Medicaid is. So I'm going to look at this calculation, and this person has a gross monthly earned income of $1,200, and they have a unearned income, which is a Social Security benefit of $1,300. So their total is $2,500. Now this person has a waiver. So then there's a personal needs allowance that can be subtracted from their total income that's counted, and that's $1,939. So then the remainder is $561. Then there's a $65 income exclusion. So then you have $496. The remainder is 496. Now, this can go either way. If somebody does not have a Medicare and does not have a Medicare premium, the individual is going to pay $496 a month for their Medicaid, and they'll have to pay one of their service providers, whether it's a homemaker personal care service provider, day program provider, non-medical transportation provider. But that's who the individual have to pay, and then the provider. There's certain ways of billing to show that they received that funds, and they won't get paid through DODD on that monies. Now, if somebody has a Medicare premium, then we're going to go and we're going to deduct the Medicare premium. So the remainder is $294 a month. So this individual with $2,500 a month income combined has to pay $294 a month for their waiver, for their services. Now, if somebody has this, the other thing, if somebody does have earned income and they have a waiver and they end up with a patient liability, they can most likely then turn and be eligible for the Medicaid Buy-In program, which has a different calculation, so they would not be paying $294 a month. Okay.
Oh, back to me.
Yep.
Yep, back to me. Okay, next gen My Care. Not going to go into detail on this because it's a whole other presentation in and of itself. But just to let you know, and if you're an SSA or an ISC, you probably already know anyway. Several years ago, there was a test project in 28 or 29 of the Ohio counties called My Care. And what it basically does is it coordinates those who have Medicaid and Medicare to one area. So you're not going to two different entities to get help, guidance, information. Then this year, the state of Ohio decided to roll it out to all 88 counties. It's rolling out in phases. There is a whole lot to it. It is kind of a cluster for some right now, but I think it's going to be a really great option for people who are Medicare, Medicaid in the future. ODM, Ohio Department of Medicaid, has put together an immense amount of information. And I believe Lisa put the presentation in the chat. If you click on those links, it will take you to those websites. And I use them quite often. It's very, very detailed. Next chart. Okay, what changed in 2025? What to expect in 2026? Well, if you're in the world of disabilities, specifically benefit, things are changing constantly. They have been, and I don't see that it's going to stop. For Medicaid buy-in for workers with disabilities, as Christine had said, or alluded to, there could be a monthly premium for that benefit every month. It depends on, countable income. Last year, the system that sends out the billing for the premiums broke, and then the governor of the state of Ohio decided to put a moratorium on collecting premiums, and that moratorium lasts until July of 2027. I have seen a few times where people have received a bill, so people should not be receiving bills and they should not be paying for it. There's also a change to the $20,000 earned income exclusion to include unearned income, but the Ohio Administrative Code hasn't put it in the black and white words yet, but I do believe that's coming. And then again, the My Care Ohio Next Gen can seem challenging at first. I do firmly believe, as most people in our network, that it's going to be better. Bottom line here, and this happens all the time, especially for people who are benefits analysts who are gathering information for people. When someone says they have Medicaid or even Medicare, that's a very general statement. As you have seen, there are multiple types of Medicaid, all with different income thresholds and different asset levels. As Kim had said, Magi doesn't have an asset level. Well, neither does CHIP. It doesn't have an asset level either. A provider, support person, caretaker, benefits consultant, especially the person themselves, they should know and understand as much as they can about what type of benefits they have, and especially how work affects those benefits. And it's not easy, for people that we serve and families, natural supports. It's not even easy for us that are supposedly experts in the field to understand it. So just get familiar with those things. And when you are serving people, if they have questions, know that there are people that can help them through it.
Darenda, if I could say something to say to people, if anybody is on a DD waiver but they have Medicare and Medicaid, they're not going to be sent to that MyCare waiver.
Right. We just didn't want to go into all the details,
but I wanted to point it out.
Yeah, you're absolutely right, Christine. There's a lot of that in there for sure. Thank you so much. I think, resources, all kinds of resources out there. The following agencies can help, Job and Family Services for the Medicaid and the Medicare savings programs. Those are the programs like QMB, SLMB, QI, Ohio Senior Health Insurance Program. A lot of people, even people who are not disabled, don't realize that every state has a SHIP program. They're there to help and assist people predominantly with Medicare. Central Ohio Agency on Aging can also help with waivers and Medicaid. Medicare.gov, Medicaid Ohio, and then certified work incentive practitioners.